Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? Morgan, and today we have a special episode of Pulse Check. I'm joined here with one of our very own students, Tez, and we are going to talk through her nursing journey. Welcome to Pulse Check.
Thank you so much for having me.
We're so excited that you're here. We were just chatting before we started that right now is back to school time. Some of us are going into our first semester of nursing school, and it is scary. It is hard. We need some motivation. So you have such a cool story. I cannot wait to share it with our listeners.
Thanks. I can't wait to tell you as much as I can.
Yay! So start off, just intro yourself. Tell us a little bit about your nursing journey so far. Maybe like what inspired you to go into nursing and just like how you got started.
Yeah, I definitely have a little bit of an, I guess, atypical story because I never wanted to be a nurse. That was never my plan. I always knew I wanted to work in pediatrics as a kid. That was like my thing, and I've never wavered from that. But I became an EMT when I was in college because I wanted to get clinical experience because I knew I wanted to do something further in medicine. And I really just wanted to get hands-on. So I did that while I was in college through a fire department that paid for my classes, which was a huge perk because I was a broke college student. And from there, I also started working for a level one trauma center that was in my area, doing scribe work and being an EMT there as well. And then I, on a whim, basically, once I got rejected from PA school, even though I kind of met all of the stats that were, I was being told were the requirements, I felt a little bit disillusioned. And there was an accelerated second degree nursing program near where I was living that I was really interested in. It was a 15-month program. And seeing as I already had my bachelor's degree, that's the reason why it could be so accelerated because your credits transferred. So I applied and I got into that. And I kind of just did a 180 and was like, well, I guess I'm going to be a nurse now. And I did that program and I graduated about 2 years ago. And I am now working as emergency room nurse.
Amazing. Oh, that's so cool. I have not a similar, but whenever I start off telling my nursing journey, I say the exact same thing you did. Like, I didn't plan to be a nurse. This wasn't. And then I didn't plan to be a nurse educator. Like, everything just happened to me. And I'm
Right.
very grateful for it. But it's
Right.
like,
Just happened.
it just happened. It just happened. And I'm so glad. But that's great. So talk us through an ABSN program is intense. Doing everything for a BSN degree in 15 months. Whew, holy cow, that is a lot. What did nursing school look like for you?
Nursing school was very, very difficult. I think that anybody tells you that nursing school wasn't difficult is lying to you
Agree.
personally. I don't know how people say like, yeah, it was. I've heard quite a few people say that, and I'm like, I just don't believe you. I personally have always been the kind of student and person that I would much prefer to be in misery for a shorter period of time versus dragging out the inevitable. So for me, it made the most sense. One, because I was already in that college mindset, right? I was already planning to go back to school. I had just graduated college. So I personally didn't want to lapse in terms of like, let's take a few years and then go back because I feel like if you're already in the mentality, you might as well just capitalize on it. My program was right out of the gates really intense. You start clinicals your first semester versus like second and third semester. You're basically like maxed out on credits every semester as well. And I think had I not been an EMT for years prior to going to my ABSN program, I would have had a much harder time with the program because for me, clinicals was the easy part. And I'm not saying this in an arrogant way, but just because I already had bedside manner, I knew how to interact with patients, I knew how to do assessments, I knew how to assess vital signs, things like that, that a lot of people in my program were learning for the first time. And so the curriculum to me was the hardest part. The didactic portion was definitely the harder part. I think the hardest class for me was Mother Baby, despite loving the content.
Yeah.
It was just so many things can go wrong all at the same time, always. And I really struggled with delineating between what was going wrong exactly then. But I think in the long run, it was really worth it. My program was 15 months, so it was divided into 4 semesters. And I feel like the summer semester was definitely the hardest because you are in class like Monday through Friday, nonstop, and clinicals, and you have 2 clinical days, and you basically have multiple tests every single week, if not some on the same day. But the second you finish your summer semester, if you're in an ABSN program, the second you head into that last semester, you're like blink and wake up and you're like, holy cow, it's over.
It's
Like that,
over.
that's it. And then you become a new person.
Wow, absolutely crazy. Multiple tests a week, juggling the clinical plus the didactic. I mean, there's so many balls in the air and they're all really important balls. You're like, I'm
Right.
doing all these things that add a lot of value to the future nurse I'm going to be. Do you have any tips or methods that you took to keep those components organized? Like, I have clinical this day, I have this assignment. I mean, multiple tests a week. That in it of itself is a lot to organize.
Yeah, it is. It definitely is. I think in terms of the study tips, my biggest thing was you got to figure out what kind of learner you are. I have always been a visual learner. I like to see it. I like to physically do something if it's a skill that I need to practice. So for me, I really liked videos. If there was any like videos on YouTube or looking at the pictures and charts and graphs in my teacher's lectures and my textbooks, and then making my own notes based off of the things that I was seeing and practicing. For me, listening is super helpful, but it's like to a point. I need to like be able to, it needs to be tangible to me. I need to be able to see
Yeah.
it. So learn what kind of learner you are and capitalize on that. I personally use the Pomodoro technique with studying. And nowadays they actually have like a plugin on Chrome and stuff like that where you can literally like link it in your computer. And so if you don't know what the Pomodoro technique is, it's basically where you have time slots for how you're studying and you have breaks in between. So you're not just sitting down for 3 hours and then being like, I don't even remember what I was studying. So you do 25 minutes on of studying, then you get a 5 minute break and you do that cycle a couple of times. And then I believe the fourth or fifth time you get a longer 30-minute break. And that way you just have a little bit of time to reset. I usually would stand up and walk around away from my computer and my notes. And I think that helped me, especially I have severe ADHD. So that made it
Yeah.
even
You
better.
like have to move your body to keep your mind active
Right.
100%.
Right. So, in terms of the academics, that was my tip. When it comes to clinicals and balancing your schedule, it's near impossible to like maintain a social life and do the things that you love for yourself to take care of yourself, no matter how hard you try. But one thing I really tried to do specifically in my summer semester, because that was when I felt like I was really struggling, and I think we all were really struggling, was take 10-15 minutes once I got home from school before I started studying to go outside. It sounds so small and like, duh, you'd obviously like to go outside, but I swear, like committing to it, and I would sit on my back porch and just stare at the sun for 10-15 minutes before I committed to being inside for the rest of the
Yeah.
night, you know and it's so small, but that really helped me. That and like occasionally going when I was able to going on a walk
Uh-huh.
just to like completely, I felt like I shut my brain off, disassociate for whatever period of time, and I could come back a little bit rejuvenated.
Yeah. Yeah. Even if you're not like, oh, I'm a new person, that 15-minute reset, especially in the sun, like
Right.
getting some of that vitamin D, there's something about the sunlight that does so much to help us reset. I feel the
Yes.
same way if I've got back to back meetings. I set a setting on my calendar for speedy meetings. So an hour is actually 50 minutes. So that gives me that 10-minute window.
Right.
And I'm
Oh,
like,
that's a good
get me in the
idea.
sunlight.
Right. Yeah, it's just you got to do the little things. That
Little
might not,
things.
that seems crazy to some people that I'm like, wow, I really need a 10-minute walk, but I swear like it was the
Yeah.
thing that kept me going. So,
It's huge. I completely agree with you. So, obviously, very intense. You did a great job of juggling. Talk to us about your NCLEX prep. I know a lot of our listeners are getting ready for the NCLEX, or I mean, honestly, we're thinking about it from like day one.
right.
So, walk us through your NCLEX prep journey.
So, another atypical experience for me. I personally like my actual prep wasn't necessarily atypical, but because I was in an ABSN program, I graduated in December versus in May, where a lot of people will graduate. And so, in one way, that helped me because in terms of like actually getting a seat for the NCLEX, I felt like it was a little bit easier than the people that were doing it when the majority of nursing students are graduating. The whole process is you need your diploma, then you need your authorization to test from whatever state and entity is going to be allowing you to take the NCLEX. And so for me, I went to an out of state school from the state I lived in. So my authorization took a little bit longer to process. So once I got that, I immediately decided I heard a tip online, like well before I actually started studying, that was do not overwhelm yourself with 15 different resources. Pick one resource to study with and commit to it like it's your job. So that way you're automatically eliminating the overwhelming aspect of I have 5 textbooks in front of me. I have a video going from this person and that person. And so for me, it happened to be Archer. I heard great things. I had done a lot of research on some other competing brands, and I committed to doing one of the like readiness exams through Archer that you can do through the portal a day. And then every couple of days doing like that CAT exam where it's like it tells you really how you're lining up in terms of preparation. And then every day I would take notes on the things that I was weak on and watch videos and go back in my notes and study those specific categories and sections.
Nice. I love that approach. I love how you mentioned specifically pulling out the things that you're weak on. Something that I learned about myself was like, I really loved cardiac, and I later went and worked in a cardiac ICU, and that was great. But I was inclined to study cardiac. Like, it made
Right.
sense to me. The heart worked. What didn't make sense to me was neuro. I was never good at neuro. That just didn't click. So I avoided studying it. And honestly, this was pretty subconscious. I wasn't like making the choice, like, I'm never going to look at this, but my
Yes.
scores suffered because of that. So if I had had something like Archer that was pulling out, like, hey, Morgan, X, Y, and Z are what you're not so good at, like, watch these exact videos, that I think would have helped
Yeah, I think it's you have to kind of humble yourself honestly and
for
be like,
sure.
okay, this is the reality of I'm really good. Like there were a couple things, same thing. I love cardiac, I'm ER, EMT, like that's pretty much
Totally.
everything. But me and the respiratory system are not friends. We don't like each other. We love our respiratory therapist. So for me, I literally was like avoiding ventilators like the plague. Like I was like, please do not ask me a question because I don't know the answer.
Yeah.
And I also happened to be studying for this when I was post tonsillectomy. So I graduated nursing school and then I got my tonsils out because I didn't have 2 weeks off throughout my entire time of nursing
Oh
school
my
where I
God.
could get my tonsils out. And I was getting strep like every
You're like,
month,
this is my graduation present to myself.
quite
They're my
literally.
tonsils.
Yes, I was like, me and Archer were best friends. I couldn't talk, but I could study. So
I
that
can
was
study.
that
I
was
can
what I
watch this
needed.
video.
Right. But yeah, no, I think really like making yourself self-aware of the
Yeah.
things that you're good at and not good at.
Yeah.
And then also just there are some good sense things that you should just know, these like little quippy nursing things. And I think Archer kind of like throws that into the
Yeah.
videos, throws
Yeah.
that into the practice exams where you're like, okay, I
Yeah.
probably should have known that like one tip.
Well, and just pulling it out so that you can reinforce. And then, like you were talking about earlier during nursing school, we have to actually take that and do something with the knowledge. We can't just like listen to this video and go on about our merry way. Our brain is not going to move that into our long term memory, which is going to be useless to us on NCLEX day if we don't remember it. So, like, watch the video on Archer, like, go through the notes, pull out the key concepts, but then do the practice questions. And then that's all going to circle back into a loop of, hey, here are your strengths and weaknesses. So you get like a customized go forward plan.
Right. Yep,
Yeah.
I couldn't agree more.
Amazing. So shifting gears, that's how we studied. That's what we did. How was your mindset though? Like, this is super stressful. This is not a fun time. We'll just disclaimer there. The NCLEX isn't necessarily going to be your best memory in life. Talk us through like what was your mindset leading up to it? How did you manage the stress, the pressure, anything around that?
Yeah, I think I would love to be the poster child for test taking anxiety. When I was a kid, I literally used to like throw up before I would take a test
Oh,
sometimes. So me and any form of tests are all automatically, I'm like, okay, I'm preparing for like the worst day of my life. I luckily was kind of familiar with the environment being in like a Pearson center and having the active test because the NCLEX now, especially with the new gen, adapts to kind of how well you're doing and kind of flows with how you're answering these questions. So the
right.
National Registry for EMTs is the same way. And so the only thing I had in my favor was that I was not a new to the environment and the look of how this was going to go.
Yes.
One thing I will say with Archer that I was very pleasantly surprised about is it looks exactly like the actual NCLEX, like to
Yeah.
the T with coloring and things like that. And so my brain immediately was like, oh, I'm just taking another Archer test. Like I'm in this crazy environment with the white walls and everything, but like I'm sitting down and taking the same thing. I was like, the day that I got medically cleared was the day that I took my NCLEX.
Oh my
So I
gosh.
was
You were not
definitely
wasting any time. You
no
were like,
time wasted.
let's do this.
No time was wasted. So I was definitely like feeling a little wacky, I guess, because I just was
Sure.
like, am I really about to do this? I had to drive a good distance to get to a testing center. So that was not great for my nerves either because I'm just like
Sure.
prolonging the inevitable. But I think the thing that really threw me was I got all 150 questions. So going off of what I was saying earlier about it being adaptive, everybody gets a different amount of questions with the NCLEX, and there's no rhyme or reason. There's no person that like nobody will, I feel like you'll ever really know why you got the amount of questions that you did.
Right.
But some people's tests shut off after 85 questions and they pass. And so that's what you hear from a lot of people. And I
I
had
passed
that
an 85 is
right.
like, yeah,
Who cares? That's
who
what I
cares?
have to say now because I felt like I prepared really well for my NCLEX, but I got to question 86 and I felt like I failed immediately.
Uh-huh.
I was like,
Uh-huh.
that's it. I'm done. There's no way I
Yep.
passed.
Like, why even continue? Total
Right.
meltdown.
So I definitely had to take a minute and center myself when I got to question 86. And I was like, you know what? This is like, I can't just throw this away and assume that I had
Yeah.
failed. So I continued on. I got full 150 questions. I walked out of that testing center and I was certain I failed. I was like, okay, awesome. I'm going to have to take it again in whatever 45 days, blah, blah, blah. So nerves were very, very high. And I think my one tip would be if you get to question 86, do not let that derail you because I am proof to tell you that 150 questions and I still passed on my first try.
Yes, you have seen it here. It is
Yes.
absolutely a myth. I hear all the time, very common question, Morgan, I got 86 or 85. Does that mean I passed? Or I got 150. Does that mean I failed? And on both ends, the answer is no. Like
Right.
you can pass or fail at both the minimum and maximum.
Yep.
It has no relevance to if you passed or
Exactly.
failed. So
Exactly.
piece of advice I always give is plan to get 150 questions.
Yeah.
Like walk in there saying, that's what I'm doing. I'm going to take a test that is 150 questions. Don't even
Yep.
think about it being adaptive and plan to take a break at question 86. Because if
Yes.
you get question 86, you're about to be stressed. Like it just is. Let's
And you
just
can't
accept
talk
it.
in those testing centers either. So I'm
Yes.
sitting there like, but you
Absolutely.
know, you're gonna make
Losing
drive
my
yourself,
marbles.
yeah,
Yes.
drive yourself
Yes.
crazy for no reason.
For no reason. But it is just so hard. It's such a mental block. And I have had students that kind of go downhill after that point because it's just a block. There is no, like, they know the stuff, but they can't get the questions at that point. Like, they're not receiving information. So tell yourself you're going to get 150, plan for it, plan for a break at 86. Like, okay, I'm on the back half. Great. Just do it. And like Tess said, like living testament, you can pass at 150. Don't let anyone tell you otherwise.
Yes, definitely.
So what was it like finding out that you passed?
I actually didn't find out from the portal. I found out because
Okay.
I got my state license
Oh,
before. So I think I took the test on like a Wednesday and then like Thursday afternoon I just got a email from my state board of nursing being like your new license is active and I was like
like, am I a nurse now?
right. Immediately, I was like, no, it's not. I gotta like look it, and I was like, this is probably spam.
Super scam.
Which is unreasonable and not correct. But I was home alone, so I didn't have anybody. Like my husband was at work, I didn't have anybody to celebrate with and be like, oh my gosh, I passed. But honestly, the biggest thing was it was just a relief. I didn't really have any
Sure.
like crazy celebration. I didn't
Yeah.
feel like
Yeah.
let me go, out to dinner or do something crazy. I literally was just like, okay, finally, like the 15 months of nonstop
Yeah.
moving and thinking and functioning could finally rest because now I'm a nurse.
Yeah. Yeah. Amazing. So then how was that transition? Like that was a rough 15 months, but being a new grad nurse is challenging in very different ways. Did you have a job when you graduated? Like where did your story go from there?
Yeah, I did. So while I was in nursing school, even though I was in an accelerated program, I worked PRN as a medical assistant in family medicine in the hospital system that I actually did all my clinicals at, and I now work at as a nurse. And so for me, luckily, and I had, I think you should always just like keep your options open, even if you are
Totally.
tied to a, healthcare system and they're guaranteeing you a job post grad and things like
Mhm.
that. it's worthwhile just talking and getting some context on whether or not it's a good offer, whether or not it's a good fit for you. And we luckily in our last semester had a bunch of different hospital systems in the area come and speak to us to kind of tell us like, hey, this is what we have for you. Let us know if you're interested. But for me, luckily, it was a promotion. So I actually got the job in October, and I knew that I would just be promoting from that medical assistant role to an RN1. And I was super grateful because it ended up being the place that I did want to work. With my experience as an EMT, I knew I was one of those people that I think I'm a little bit of an anomaly, but I went into nursing school and I was like, if some other specialty speaks to me, I'm going to be floored. Like I was
Got
like,
you.
my brain is
Yeah.
ER, my mindset is, I didn't let that like taint my experiences in clinicals. I
Sure.
did actually do my preceptorship in the ICU because I was like, let me just keep an open mind and
Yeah.
see. But at the end of the day, it's just what works for me.
Yeah.
And I think some people go into it like, I have no idea what I want to do. And other people go into it like, I know that this is what I
Yeah.
want to do. So yeah, I had a job, which was really nice. I think one thing is I personally felt like a lot of people in my program stressed about job search in like the beginning of the year, meaning like end of our second semester when we still had
Oh,
2
that's
full
early.
semesters
Yeah.
left. And for me, I think one thing that really helped with my overall like stress of just life was I did not start seeking out this job until I finished my third semester because to me,
Okay.
in my mind, that was when I was like, okay, I'm graduating now. Like I know for a
Yeah.
fact I can get through the last semester and
Right.
now my eggs are all in the basket of I need to be employed versus I need to pass and actually get to that
Right.
point.
Right. It also gave you more time to feel out all those clinicals and
Yes.
specialties. I love that you mentioned like I was pretty sure going in this is what I wanted, but not everybody keeps their mind open, and I think that's a missed opportunity.
Yeah.
A quick caveat from my graduate school experience, I went into a dual acute primary pediatric nurse practitioner program thinking I have spent my whole nursing career in ED and ICU. I love acute care. I'll get the primary too to be like robust and comprehensive. I'm going to be so smart and fancy. But like I'm going to hate primary care. Like
Right.
I'm going to work in a doctor's office. Like I hadn't even been in a doctor's office unless I was getting a checkup. I walked into primary care, Tez, and I flippin' loved it. Are you kidding me? Kids are healthy. They're not on ECMO. I was like, what? I love this.
You're saying all the same words I say. I'm like, I love children. I just don't like them when they can't breathe because
Yes. Uh huh.
I need you breathing and talking about your light up shoes and Bluey and all this
Yes.
stuff. Like,
It was like so unexpected. And I am so grateful that I pivoted. I ended up not finishing the acute care program. I was like, I'm all in on
oh,
primary care. This
that's
is what I
awesome.
want. And I think it was the first time in my career I had allowed myself to shift and be like, what I thought I want wasn't what I actually want. And that's fine. Like,
Yeah,
I'm allowed to change that. So, this is
absolutely.
your permission to everyone listening. If you go into school and you love something different, it's cool. You can shift so many times. Nursing is amazing because you can shift a gazillion times throughout your whole career. It's so
Right.
cool.
Yeah, I actually think the thing that probably surprised me the most when I was in nursing school clinicals was my favorite clinical by a landslide was my labor and delivery clinical.
Oh, no way.
I always liked women's health. It
Yeah.
wasn't a matter of like, oh, I just don't like that. I don't think I'm gonna
Yeah.
like it. But it was so profound to me. Like I was in multiple deliveries and I just was like almost existential with
Yeah.
what was happening and the fact that I was
Oh,
witnessing it for somebody that I didn't know.
yeah.
And then also just the fluidity, like in an emergency room and an EMS, you are a team first and
Yeah.
foremost every time. Seldom are left alone. And even though you have to have your own thoughts and ideas about how you want to treat this patient, you always have a helping hand. And I think labor and delivery really exemplifies that as well because
Yeah.
you need a team. It's not just one person delivering
Yeah.
this child. It is so many different
Yeah.
factors. So yeah, that really surprised me. People still ask me that when I have nursing students at work and stuff like that. They're like, "What clinical did you like most?" And I was like, "I didn't even like my ER clinical. I'm an ER nurse as much as I liked my labor and delivery clinical." So, and I had
And
no interest in working in L&D. I just really enjoyed the clinical.
that is so funny to me too, because I feel like if there are two opposites of specialties out there, or like if you generalize like the stereotypical ED nurse and L&D nurse, like polar opposites.
Right. Like get the baby away from me is
Right.
every ER nurse ever is like when somebody comes in delivering, we're like, and how fast are we getting you
Yes.
upstairs? Exactly.
Like, do not even come in here. So funny. Oh my gosh. Well, I know we're running out of time. I have two rapid fire questions to end our episode with.
Sure.
The first thing is, what advice would you give to someone who is just about to start studying for their NCLEX? One little tidbit for them.
Pick one thing and stick to it. There's no use overwhelming yourself with 58 different
Yeah.
resources. Everything's going to get you to where you need to go. Really commit to one resource and save yourself the trouble of being overwhelmed when you're already overwhelmed.
Yes, I love that. I share similar advice. Like, I don't even care what you pick.
Right.
It honestly, different things work for different people. That is
Yeah.
cool. But when you buy or your school buys 10 different things, it is impossible to keep up with it all.
Yep.
And you're right, Tez, you will be more overwhelmed and
Yeah.
it's not
Just
worth it.
save yourself like you're going to be this overwhelmed, cut off this much.
Yeah, shave it off. I love it. All right, last question for you. If you could go back to day one, I'm about to walk into my first nursing school class, what piece of advice would you give yourself?
That's a really good question. I think I would say, just keep reminding yourself of the reason that you're here, because every time that you're going to feel really overwhelmed and just feel like, okay, did I really make the right decision? But I look back on it now and I love being a nurse. I am so grateful. It's my career. I think it's one of the best careers you could ever have because, like you said,
Agreed.
you can rotate. So I think maybe it might feel overwhelming. Like you have to do this, you have to do that, you have to go into med surg, you have to go wherever. But remember that you have so much flexibility.
Yeah. It's not an end point like a lot of people think it is. I mean, there's milestones along the way, but you're going to be learning and growing and pivoting your entire nursing career, which is challenging and beautiful. It's a lot of ands, it doesn't have to be one or the other.
It's definitely.
Really cool. Well, we are so grateful for you coming on to share your story. Where can listeners find and follow along with your journey? I know they're going to want to keep up with you.
You can find me on Instagram and on TikTok at the PNP pathway. The PNP stands for Pediatric Nurse Practitioner Pathway.
The best nurse practitioners.
The
just
best
a
nurse
plug.
practitioners. And I post my lifestyle content, tips about becoming an ER nurse, nursing school, how I became, got to where I am now. So follow along. I also have my Archer link in my bio too, because I happened to use them and love them. And now I work with them, which is the biggest honor ever. So
I love it. I love it. Well, we're thrilled to be a part of your journey. We're honored to walk alongside all of the future nurses going through what is hard but worth it. Remember, it's never easy, but it really is worth it. So thank you guys for being here. Thank you, Tez, and we will talk to you later.
bye.
All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.